All right. Thank you guys so much for joining. Let's give maybe another minute or two, and then we can go ahead and get started.
I guess as a like a beginning introduction type of thing. If you guys have any questions that you would like answered about COVID, we'll see if we can give you those answers. Maybe let you know if we'll be covering this kind of topic or get an idea of what we want to cover in the future. Okay, we want to start sharing. Okay, let's do that. But yeah, I mean, I guess if any of you guys have any specific questions as of right now, what we're trying to do or anything of that nature, we'll be happy to take them until we go ahead and get started. If not, that's okay too. That's completely fine.
All right. If there are no questions, we can go ahead and get started. So, hi everyone. Thank you guys so much for attending the session today. My name is Josh, and today Isha, Shreyas, and Zed are going to be here to present this project to all of you guys. So, before we start, be sure you guys have your phones because we will have plenty of QR codes and links for you guys to follow along during the presentation. So, we're really excited to share this big project we've been working on for the past few months. It's called Texas COVID Connect. And our goal is basically to create a central hub of just accurate, streamlined information on the COVID-19 pandemic, just to spark motivation, spark movement in Texas and beyond. So we really want to start change from within the community, and we hope this project can really inspire and inform people like you and me.
I guess it's a brief little introduction. You guys want to wait a couple more minutes? You think we got everyone else?
I think we're good to go for now.
Okay. In that case, you should take it away.
Next slide. Cool, thank you. So during our presentation today, we will first introduce our website, Texas COVID Connect, which is a platform that aims to streamline information on the COVID-19 pandemic. So we will then cover various aspects of our Be Proactive, Not Reactive initiative, such as our COVID-19 checklist, risk assessment, and many other future projects. Along with the educational aspect of our project, we also wanted to start conversations about various issues that have been on the rise during the pandemic. And we have decided to address these topics through our podcast. And lastly, we will wrap up by touching on various ways you can get involved with our organization and in the community.
Right. So our focus with Texas COVID Connect is split into four main areas. Firstly, we wanted to use the website as a platform to educate the public on important topics like vaccines, safety methods, and other subjects where people may have a lot of misconceptions. And our goal is to clear up this misinformation and provide people with a solid foundation of information to use whenever necessary. Another area of focus that we have is connecting people to various volunteering opportunities and allow them a way to get involved within their local communities. Fundraising is another way for us to achieve this and gather people to promote the overall public health of our community. Finally, we also wanted to create our own personal initiatives through which all of us and our colleagues can come together. And the two we have lined up so far are our COVID risk assessment and care kit.
So with that being said, we introduce you guys to our Be Proactive, Not Reactive campaign, which was created by our team. Okay. So to kind of start off, we kind of wanted to go on a little tangent and say, talk about the importance of having a plan, especially during this time. And to be completely honest, it's one of the most proactive things that we can do to help ourselves during this time. So obviously, everyone has their own needs and wants during the pandemic. And for a lot of us, waiting isn't something that we're interested in doing. And we've seen that from the statistics. As we've seen a brief quarantine period in around March, April, that time. From that time, cases have only continued to rise. People have, wanted to continue their sense of normalcy. And I guess that's something that we have to live with. And there's really no real action. There's really no real action and undisputed way to kind of fix the pandemic. So a lot of the responsibility and action taking falls on us as people. So we need to understand and truly believe that every time we step outside of our house, we really do put ourselves at risk and those close to us at risk for contracting COVID. So with this in mind, it almost seems foolish not to have a contingency plan for you and your family if you contract the virus. Additionally, from personal experience of having COVID and my family also contracting it, it became evident that a lot of the struggle with dealing with this particular infection is the mental aspect of not being able to completely understand what actually is going on. Because if this is a new virus and there's not a lot of information on it at the moment, so that mental aspect can be a very, very big part. And so having a plan can really streamline and facilitate what needs to happen when.
So the first major part of this campaign is the COVID-19 checklist, which is the product of research that we've compiled on our own and our own personal experiences. And it will hopefully serve as a helpful resource for people to not only create their own personal preparation plan in the case they do contract the virus in the future, but also provide helpful advice based on for those who have already contracted the virus. This includes information on maintaining proper quarantine protocols, how to reduce infection within your community and at home, and also other important areas of info that will help minimize the spread. And feel free to scan the QR code to follow along while we go more in depth about our checklist.
We'll give you guys a couple seconds. If you guys got a secondary device of any sort, there's QR codes throughout the entire presentation. So it would be awesome if you guys could check them out. I'll give you guys a minute, or probably less than a minute. Okay.
Yeah, so as you guys can see on the PowerPoint, this is our COVID care checklist. As you guys can see in the middle of the graphic, we have a few essential items that we in the CDC strongly recommend. So these are our materials and medications, and they're things that we believe everyone should have during the pandemic. And most of you guys probably have a lot of these at home. So you want to always stay prepared for any chance of COVID. As you can see, a couple of the items we recommend are a mask, thermometer, a Tylenol oximeter, blood pressure cuff, emergency inhaler if you have asthma and you're prescribed one, alcohol wipes, hand sanitizer, and gloves. So obviously this is not an exhaustive list, but we really think these essentials will make life a lot easier in the case you do contract COVID, so you don't have to go out and go buy them, after you contracted COVID.
Right. And to add to that, one of the biggest areas that we wanted to cover was how people can prepare to reduce infection both within their own communities and within their homes. So some of our biggest recommendations include designating sick rooms for those infected, reducing air droplets by increasing ventilation through either fans and windows, avoiding having visitors, monitoring the symptoms of those part of high-risk populations like the elderly and those with pre-existing conditions, and also treating your pets with equal care. Additionally, to reduce possible infection within your own community, it's essential to notify your close contacts of the situation as soon as possible so they can begin their 2-week quarantine period if necessary.
Great, yeah. And so as our motto, be proactive, not reactive, has stated, it's always important to stay prepared even before exposure to or contraction of the virus. Thus, when looking at the middle column of the pamphlet on the screen, you can see that the first step to staying prepared is to have a plan, especially regarding groceries and other food items. There are many alternatives that families can use, such as food deliveries from Whole Foods via Amazon, which is just one of the many options for grocery delivery. Furthermore, family and friends who are willing and able to help can drop off pre-made food outside of your house. So having these plans made can help ensure that you and your family have good, healthy food available, because healthy eating can lead to a faster recovery. Additionally, in order to reduce the transmission of the virus, it is important to stock up on cleaning and disinfectant supplies. Josh, you're muted.
Josh, you're on mute.
So yeah, going off of that, we also have a mental health plan. So our mental health plan is a guideline for you and your family in the case that things do get a little tense or stressful during the pandemic. We have all experienced moments like these, and we just want you guys to know we're here for you. Everything will be okay, and just always stay positive. So we want you guys to know that if you do take the precautionary measures that we listed on our website in our care kit checklist, as well as listed on the CDC, you will have a very, very low chance of contracting COVID. And if you are stressed because of a certain situation, don't push it away. Stay in contact with friends and family, even if you're quarantined. Go play some basketball by yourself if you have COVID, or just find a hobby just to take your mind off of the situation. And there are also a lot of local support groups around you that you can go to as well. In an emergency, we also provided a phone number for the disaster distress hotline that is seen at the bottom left corner of the screen.
Right, and as a part of our cleanup plan, it's important to take into consideration both cleaning surfaces and the air. So to do this, use reusable or disposable gloves for routine disinfection, clean surfaces with soap and water before using disinfectant, and maintain a consistent cleaning routine for frequently touched surfaces like countertops and desks. In addition to using aerosol disinfectant to purify the air, you can open windows and turn on fans to eliminate air droplets. Personal hygiene is another important aspect of our cleanup plan, and it's important it is practiced in tandem with the rest of what we have mentioned.
Yeah, and lastly, if you and your family members do contract COVID-19, it is important that you understand what comes next. As seen on the bottom middle of the pamphlet, it is vital that you follow your primary care physician's guidelines in order to ensure proper and full recovery. Furthermore, it is essential that you get tested negative before returning to any of your normal activities. So it is best to wait 2 to 3 days after symptoms subside to retest in order to guarantee that the virus is completely out of your system and it is safe to be around other people again. Again, these steps are vital as they can ensure not only the safety of you and your family, but also the well-being of those around you.
So one of the biggest reasons why we wanted to create a risk assessment was to provide people with a resource that will allow them to make more safe choices in accordance with social distancing protocols, while also preserving their ability to make their own decisions about where they want to go. And the risk assessment will serve as a quick and reliable way for people to determine how much they're putting themselves at risk when going out or attending outside events by assigning them with a rating so they can make the best choice for themselves and their family.
So based off of what Zed had just mentioned, the risk assessment will take into consideration these three factors: our personal severity, our close contact severity, and likelihood of infection. The personal severity takes into consideration the effect of what COVID will look like if you had contracted it. Close contact severity, same thing except for the people around you. And the likelihood of infection, the probability that based on the places that you have been recently, how likely are you to have contracted the virus? So by using the data provided by the CDC and other reliable resources, we plan to create a system that can integrate these three factors and help people make reliable decisions during this pandemic.
Yeah, so as you can see in the bottom left of the slide, we do have a couple of helpful resources for assessing the risk of a certain activity or hobby that you might want to do. So the first is an app created by medical students at Brown University, which actually gives you a couple of questions about the activity or hobby you want to do. And it also gives you a risk level after you answer a couple of short questions. So it takes about maybe like less than a minute. And for me personally, it's really helpful in making safe and thought out decisions during this pandemic. The next link we have underneath that is a link to basically every statistic you could find or need at cdc.gov. This is where the government compiles all the information for every location in our country. And this site contains many useful graphs that lets you see how our country and maybe your town or city is doing health-wise. And also just adding to what Shrey said earlier about our personal risk assessment, we're working really hard on getting that out right now. We have a developer called Frank, and he's working on the app. So be on the lookout for that. We might have an announcement soon, and we might have an app for our project as well.
Yeah, so moving forward, we do have other future projects already lined up that our team is very excited to introduce and get started on. So first, we're looking into a care kit fundraiser that will aim to raise money for those that have been affected by COVID-19 in our communities. Furthermore, we would also love to help individuals that are at higher risk of contracting COVID, through a care kit supply run. So the project aims to locate or create ways for healthy individuals to help deliver necessary goods such as food straight to their doorstep. So as we do grow, we openly invite more people to get involved in order to, incite more discussion and conversation that will help us find more ways to help out during this pandemic.
And so we've actually got a couple current projects as well. The first being the big project that we've been working on for about a month. The website is almost 1 month old. And this is our biggest project so far. And you can access it by using the QR code on the bottom left. Or visiting texascovidconnect.org. So the goal of this website, I think we mentioned it early in the presentation, but it was to streamline information regarding COVID news, reduce misinformation, especially during this time. It's become a big problem, and also provide a platform for people to make change during this pandemic. After contracting the virus myself and my whole family, the whole experience kind of shown, like, it gave me insight into the kind of perspective that a lot of us go into when looking at this pandemic. I mean, I can tell you from personal experience, before contracting it, it was like all we could do is kind of stay at home and wear masks, and when we go out, and make sure we don't, take care of our personal hygiene. But especially for the young people of in college or high school, or even middle school, there's a lot that we can still do. And for those who need volunteering opportunities or anything of that nature, we've got plenty on our website. Be sure to check us out, and we really appreciate that.
Yeah, so another big project that we've been working hard on is our TXCC, Texas COVID Connect podcast. We want this project to go beyond COVID because we know that this pandemic will pass and we'll fight through, and maybe in a year or two, or maybe within the next few months as a vaccine rolls out, situation will get better. So our goal with the podcast is to go beyond COVID and really just to inspire our viewers to start change in whatever situation they are in. We will be talking about a lot of issues such as socioeconomic disparities, racism, politics, morals, and many more that are really just hot button issues and might seem controversial at first. Our really big goal with this is to find common ground with these issues from both sides of the spectrum, whether it's politics or morals. And we really just want to change starting from within the community without having a weight on our political system, which can be very slow sometimes. So our biggest goal with this podcast is to let everyone, especially the younger generation, know that they're not the next generation, and let the older generation know that they're not the previous generation. Regardless of your age, wherever you may be, where you may live, how old you are. If you are alive today, you guys are the now generation. And we really just want to stress out in our podcast that everyone has a capability to make a change if they put in the effort and just get people involved.
So there are a lot of opportunities for you to get involved and help us in our initiative for change, whether that be through volunteering, fundraising, or even becoming a contributor for Texas COVID Connect, where you can specialize in whatever area you are most interested in. If you want to learn more, feel free to access the QR code or go to our Get Involved page on the Texas COVID Connect website to find more information on what options are available for you.
Great. So this brings us to the end of our presentation. So thank you all for attending. We really appreciate all of your interest. And if any of you guys do want to get involved in our initiative, feel free to fill out the form and on our About Us page on the website, which is texascovidconnect.org. If you do have any questions, feel free to type them in the chat, direct message us on Instagram at TXCovidConnect, or email us at txcovidconnect@gmail.com. So yeah, thank you. And if you do have any questions, you can also unmute and speak. So yeah.
Yeah, actually, can we do something real quick? Can everyone turn on the cameras? Sure, can you stop sharing the screen? We can get like a screenshot of all of this. It's really big.
Yes, we will.
Trace, can you take the screenshot? Because
Screenshot?
on my computer, yeah, I can't get everyone in
Yes.
one
I
slide.
actually need 2 pages. We've got quite a few
Shoot,
people that
okay.
came. Okay. Let me wait a couple seconds. All right, I'm gonna take a screenshot. All right, that's one. Oh, let me do it again. Okay. All right. We got it.
Sweet.
Thank you. It really means a lot that you guys came out and supported us. It was a little bit on a short notice for a lot of you. We really apologize. This is kind of the start with these Zoom presentation series. We feel like there's a lot of information that either it's either misinformation or different types of information that comes to all of us. And we feel like this is a great way to kind of make an impact directly in the community, whether it's virtually or however. So we're planning to continue this. And if there's a particular topic that you guys would like to, see for next week or another time, just let us know and we will try to get the appropriate research done to share with you all.
Do you know?
Yeah, and also I will drop my email in the chat so currently I'm hosting the podcast, right? And sometimes I kind of want to gauge what people kind of want to see for the podcast. So I will drop my email and you guys feel free to email me about the podcast and any ideas you guys might have. And if you want to get involved, feel free to let me know too.
I think we got
All right.
kind
Anything
of a
else, Trey?
question. It says, we would like to hear personal experiences to be prepared. Or does anyone want to touch on that, or is that a me question?
I think that's a you question.
Well, personal experiences, I think I mentioned it like twice now, but yeah, my family and I did contract the COVID virus. Obviously, it really does affect people in different ways. There's no real way to kind of tell how it's going to impact certain people. There's not a formula or an algorithm. It's something that nature kind of takes up on yourself. So like we mentioned, I think the checklist is something that if you follow, it will be something really helpful. And it's not something that you have to do only after you get COVID, right? The whole point of this entire campaign was to be proactive, not reactive. When we think about where we started, every single thing from March, when we found out that COVID came to the US, when we found out that New York was heavily, infected, everything so far has been a reaction. Quarantine was in reaction to the virus. I feel like if you take these steps, you can kind of get ahead, get a grasp of the situation a little bit. And so that's kind of what we intend to do. And I guess—
Hey guys, quick question. Do you think the vaccine is a cure or a prevention? And what is your take on the second wave that is hitting the US with SARS and other things?
Yeah, so I can talk about the vaccine. I know the vaccine, they say it's 95% effective. I think Moderna, and I think for Pfizer, it's like a tiny, tiny bit less than that. So I wouldn't say it's like 100% like cure to the virus, but it does do a really, really great job from the trials they've done to help with the symptoms, right? So normally without the vaccine, if you contract COVID and you're of old age, you might have some pretty bad symptoms. It might be really hard to breathe for some people with asthma. If you have hypertension, you can have heart attack, right? So the vaccine does a great job at making sure the virus doesn't just like destroy your body. So 95% effective basically means it reduces the symptoms that might hospitalize a lot of people. So for 95% of the trials they ran, it was really, really effective. So I think it's a great preventative measure, and it's like almost super close to a cure. I think, I don't know, I don't think anyone knows how long this virus is still going to be here, but from what I'm seeing, maybe a year and it'll be pretty low key. Like it'll be kind of I wouldn't say wiped out because it's probably gonna mutate, but within a year it'll be normal. There still might be like a mask, what do you call it, a mask recommendation for people who might go into like concert stuff, but yeah, it should be, you in a year you probably don't have to worry as much.
And I think just for we got a couple of other questions, but for a lot of people that don't really understand how the vaccine is intended to work. So especially with these types of vaccines, so this is the Pfizer and Moderna vaccines are actually something called mRNA vaccines. I think Isha and Zed did a lot of research on that. So if you guys want to speak on that, that'd be awesome. Unless you don't, that's okay too.
Thank you.
But essentially what it is, it's just genetic information that your body can receive, and your body actually creates natural ways to kind of fight the virus. So the next time, like let's say you do get in contact with someone with COVID, your body knows what to do. It's almost like a preventative measure. And as of a cure, obviously, there's a lot of financial and all that kind of stuff that we're still reeling from COVID. So in a way, medically, we could potentially say that it's not something that's going to help you if you already have it. You know, it's not like a medicine of some sort, but there's also a lot of, I guess, after effect and consequences that we have to deal with from the virus. So, you know, just keep that in mind. And then we got a question from Shrieker. So Shrieker is asking, what procedures can you take after contracting COVID to keep others safe? So
I can answer that question. So I think one of the most important things is to like stay in isolation and be quarantined. So if you do have, like we mentioned earlier on the checklist, like a room where you kind of just stay by yourself. And then, I mean, for like food and things just left kind of outside of your door, I think that would be really important just for you and your family. Before like returning to any like normal daily activities, make sure that you go get tested again, and then only get tested after your symptoms have like subsided and it's been 2 to 3 days since that's happened. And I guess after all of that, if you're tested negative, make sure you disinfect your home and all of that, and then I think you can be free to go out. But then again, even if you do like have antibodies and things like that, make sure that wear masks, take proper precautions, because we don't know, like someone said earlier, there could be like a second strain and stuff. So there's a lot of what ifs still about this virus. So go back and make sure you still take the proper precautions. And I think that should help keep others and yourself safe. So yeah. Any other questions, or anyone want to add anything? Yes, no? Okay. Thank you.
I think that concludes.
All right. Yes,
our
that
session.
basically.
Yeah, you got it, Josh.
Yep. So you guys are free to go. Enjoy the rest of your evening. Have some fun. Stay safe, and we'll see you guys soon.
Thank you
All right,
guys
bye,
so
everyone.
much.
Thank you.
Thank you all.
Thank you.
Thank